Hello and welcome to the Reasonable and Prudent Parenting Standard Training. This training is for child welfare workers and residential providers. At the end of this training, you will be able to define what the Reasonable and Prudent Parenting Standard is, explain why normalcy is important, list the criteria used to determine if a foster child can participate in an activity, accurately document extracurricular activities in the case file, and implement the standard in a residential facility. According to the Preventing Sex Trafficking and Strengthening Families Act, caregivers are allowed to make parental decisions based on a reasonable and prudent parent standard in order to maintain the health, safety, and best interest of a foster child, and also make decisions that support normalcy for the children. Caregivers are defined as a foster parent with whom the child in foster care has been placed, or a designated official for a child caring institution in which a child has been placed. The reasonable and prudent parent standard is defined as the careful and sensible parental decisions to maintain the health, safety, and best interest of a child while encouraging the emotional and developmental growth. The caregiver shall use the standard when determining whether to allow a child in foster care to participate in extracurricular, enrichment, cultural, and social activities. Here are the applicable licensing rules that support the standard. According to FOM 72211, when the children are placed in a residential treatment setting, the provider must incorporate normalcy activities into the residential programming. These activities must be in compliance with the reasonable and prudent parenting standard and will help children with essential skills for positive development. A designated individual who is trained in the standard must be on site to exercise the reasonable and prudent parent standard. We may ask, why is normalcy important? Normalcy is an important component of well-being for children and youth in foster care in order to ensure that they're able to have normal experiences and engage in activities that are age-appropriate and allow them to grow. Normalcy for children means being able to do what is considered routine, such as participate in sports, teams, clubs, choir, dance classes, volunteer, spend time with friends, and have sleepovers, and take trips. It also includes opportunities for youth to take on additional responsibilities and freedoms, such as learning how to drive, working a part-time job, or having a curfew as the youth approaches adulthood. Through these activities, youth learn their interests and talents, safely experiment and take risks, practice decision-making skills, and develop healthy peer and adult relationships. In determining if an activity or opportunity is appropriate for a foster child to participate in, several factors need to be taken into consideration. Caregivers and the designated individual in a residential setting need to determine the overall age, maturity, and developmental level of the child, potential risks and appropriateness of the activity, federal and state laws and licensing requirements, best interests of the child, importance of encouraging the child's emotional and developmental growth, importance of providing the child with the most family-like experience, and the child's behavioral history. Deciding these factors can be challenging and subjective. Let's take a look at a few examples to see how the standard is applied to real-life situations. The first example, a 16-year-old James brings home a permission slip to attend a school field trip during the day to a museum several hours away but within the state. James has been in the foster home for 3 months and things have been going well. What should the foster parent do? A. The caregiver can use the reasonable and prudent parent standard to make the decision. Or B. This is a decision that cannot be made by the caregiver and requires further approval. The answer is A. The foster parent must consider factors such as the potential risk, appropriateness of the activity, best interest of the child, importance of encouraging the child's emotional and developmental growth, and the child's behavioral history. As shown earlier on the determining factors slide, some questions to ask to help with this answer could be, what is the child's maturity? What could happen if the child's involved? Are there any federal or state laws regarding this activity? Any licensing requirements? How could this benefit the child? How will your child emotionally grow? How does this provide a family-like experience? How has the child been acting with you and when away from you? The second example is a child's mother calls a caseworker upset that the foster parent signed her 7-year-old up to participate on a t-ball team and did not get her permission. The foster parent has 2 other children that are also going to participate on the team. A, the caregiver can use the reasonable and prudent parent standard to make a decision. Or B, this is a decision that cannot be made by the caregiver and requires further approval. The answer is A. Playing a sport has risks, but if it is developmentally appropriate, it is within the standard of decision making for extracurricular activities. The foster parent could have a discussion with the mother about the team and invite her to attend practices or games if appropriate. A foster parent, Michelle, would like to take her niece, 14, and nephew, 16, who have been placed with her, to Cedar Point in Ohio. The children's parents have taken them there before, so Michelle doesn't think they will mind. What should the foster parent do? A. Michelle can use the reasonable and prudent parent standard to make a decision and take the children. B. This is a decision that requires further approval. C. Since the trip is out of state, Michelle is not allowed to take the children. The answer is B. Out-of-state travel requires prior approval. Michelle should talk with her caseworker to see if just obtaining parental approval is fine or if the court also requires authorization. 12-year-old Mackenzie wants to go to her friend Ava's house on Friday to spend the night. The foster parent has met Ava's parents once at a school activity, and Ava appears well cared for. What should the foster parent do? A. Ava's parents seem nice. The foster parent should let Mackenzie spend the night. B. Call Mackenzie's caseworker to ask, but decide not to let her go because it's Friday and the foster parent did not hear back from the caseworker. C. Talk to Ava's parents to get more information about what the girls will be doing and who will be supervising. The answer is C. If the foster parent feels comfortable after talking to Ava's parents and has reviewed the factors that should be considered when applying the standard, they can approve Mackenzie to spend the night. Lucas, 13, wants to spend the night at a friend's house where they will be riding four-wheelers. Lucas says his friend rides them all the time and he promises to wear a helmet and be safe. What should the foster parent do? A. Due to Lucas's age, he is not permitted to operate a four-wheeler without valid off-road safety certification and direct supervision of an adult. B. Call the friend's parents to get more information. C. Trust that Lucas will make safe choices and wear a helmet. The answer is A. Foster parents must comply with all laws and ensure that foster children have required safety training before permitting them to participate in an activity. Alexander, 12, wants to go hunting with his foster father, who is an avid hunter. What should the foster parents do? A. Sign Alexander up for hunter safety to get his hunter education certificate. B. Tell Alexander no. Foster children cannot go hunting. C. This is a decision that cannot be made by a caregiver alone and requires further discussion and approval. The answer is C. Hunting and gun use requires further discussion and approval from the caseworker and parents, if applicable. If agreed upon and the child is found to be appropriate to go hunting, all laws must be followed and all hunting certificates and licenses must be obtained. The Green family wants to take an overnight trip up north to their cabin with their 3 foster children. They plan to go on their motorboat if the weather is nice. The trip would not interfere with any parenting or sibling visitation. Can the Green family make this decision? A. No, since the foster family will be boating, this is not a decision they can make. B. No, the foster family cannot leave overnight without approval. C. Yes, this is a decision that falls within the reasonable and prudent parent standard. The answer is C. As long as the Green family is not leaving for over 48 hours and are complying with all boater safety rules and proper life jacket use, they can take this trip with their foster children. Kevin, 14, wants to use his laptop to connect to the foster family's internet for checking his email, social media, and general internet use. Can the foster parents allow Kevin to use the internet? A. Yes, this is a decision that falls within the reasonable and prudent parent standard. Or B. This is not a reasonable decision to be made by the caregivers. The answer is A. The foster parents should discuss house rules such as hours and daily length of time allowed on the internet. The foster parents must consider the child's age and development when establishing guidelines and supervision for use. There should be regular and ongoing conversations about safe and appropriate internet use and the risks of providing personal information on the internet via email or social networking sites. Amber just turned 13 and she wants to ride the bus to her foster home after school, where she would be alone for 2 hours until her foster mom Rose got home. Can Rose make this decision to allow Amber to stay home alone? A. No, this is not a reasonable decision to be made by a foster parent. B. No, Amber is not old enough to stay home alone. C. Yes, this falls within the reasonable and prudent parent standard. The answer is C. Rose must use the factors that should be considered when making this decision. If Rose feels that Amber is developmentally appropriate and has demonstrated responsibility and good decision-making skills, then she can permit Amber to stay home alone for short periods. Rose must help Amber develop a safety plan to include emergency numbers, procedures, and how to contact the foster parent. Rose should also set safety parameters around things such as activities Amber can or cannot do, such as answering the door or having friends over. Abby, age 9, has expressed to her foster parents that she would like to go to church with her friend Danielle from school. Abby has been placed with the foster parents for 9 months, and her parents have never expressed a specific religious preference. Which decision should the foster parents make? A. This is not a decision to be made by the foster parents. They should contact the caseworker. B. This falls within the reasonable and prudent parent decision making. If they feel safe letting Abby go with Danielle's parents, they can let her go. C. Danielle's church is not the same denomination as the foster family's church, so they decide not to let Abby go. The answer is B. The foster parents should talk with Danielle's parents to ensure they feel comfortable allowing Abby to go with them. Next are a couple of residential facility questions. Mark, 16, is in a residential facility. The facility is having an outing to the zoo, and Mark is on the list to attend the outing. True or false? This is a scenario where the facility could apply the reasonable and prudent standard. In this case, it is true. The facility can make the decision to allow Mark to attend based on collaboration from Mark's counselor and/or other staff. The facility does not need permission from Mark's DHHS caseworker. Heather is 17 and in a residential facility. She has been allowed to get a part-time job at a local restaurant where she is allowed to work afternoon and evenings, not past her curfew. On a Friday night, the restaurant is understaffed and they ask Heather to stay an hour past her shift. Heather calls the facility to get permission. Is this a decision that the facility can make? A. No, the facility cannot make that decision. B. Heather's caseworker would have to make that decision and she is off shift, so no one is available to make that decision. C. Yes, the facility is required to have a designated official or officials trained in making the reasonable and prudent parent decisions. The answer is C. The designated official is able to make that decision whether or not it is appropriate for Heather to stay an hour past her curfew to work. There are many situations and activities beyond the examples we have looked at today that fall into the reasonable and prudent parent standard. As you have seen, some of the activities need prior approval from MDHHS, the court, and/or the child's parents. Here are some examples of activities that require prior approval. Any events or activities over 48 hours, any events or activities that are out of state, participation in religious or cultural practices outside of the legal parent's chosen religion, hunting, range shooting or target practice, children riding as a passenger with an adult on a motorcycle or moped, children operating motorized equipment or vehicles. They must also follow all age requirements and have proper training and/or certification. Driver's license. Only a parent or guardian can sign for an application. Entering the military. Haircuts that change the child's appearance, permanent hair color, piercings, tattoos, and a baby's first haircut. Although we have touched on the reasonable and prudent parenting standard today and have discussed some examples of how it is applied, there are numerous other situations that may arise that have not been covered. Please refer to the DHS 5331 Caregiver Guidelines for Reasonable and Prudent Parent Standard for additional clarification. This can be found on the Public and Michigan Department of Health and Human Services webpage under Doing Business with DHHS tab or in the DHHS Forms Library. The Caregiver Guide also provides a list of applicable references that can be of assistance, such as boater safety, off-road vehicle or all-terrain vehicle use, and hunter safety handbooks. So how does this impact the work you do as a child welfare worker or residential staff provider? The next few slides will take a look at issues surrounding engagement of a biological parent who does not wish to allow their children to participate in extracurricular activities, how to document extracurricular activities in the case file, and residential requirements. Although caregivers are able to make daily decisions regarding participating in activities that support normalcy, the biological parents of temporary wards still maintain certain decision-making rights while their children are in care. Caregivers should be sensitive to biological parents' input, and engagement between caregivers and parents should be encouraged by the caseworker. In order to fully engage the biological parents, remember the My Team skills of engagement. Empathy. Recognize the person's feelings and thoughts. Communicate with your words and understanding of the person's experience. Power differential. The role difference between two people that result in vulnerability on the part of the less empowered. Frame of reference. A set of ideas, conditions, or assumptions that determine how something will be approached, perceived, or understood. The caseworker is responsible for documenting that the child has regular, ongoing opportunities to engage in age or developmentally appropriate activities, and what the foster parent or child caring institution is doing to support those activities in line with the Prudent Parent Standard. This information is to be documented in the Supporting Information section of the Case Service Plan under the Child tab in My SACLIS. The documentation should be in response to the question, describe the child's perception of circumstances, including engagement process, intervals of discussion, and behavior. The residential caseworker is responsible for documenting that the prudent parent information. The information will be documented in the Parent Agency Treatment Plan and Service Agreement under D, Residential Care Treatment Activities. For youth with the permanency goal of APLA, a demonstration of support for engaging in age or developmentally appropriate social activity needs to take place. At each permanency hearing held with respect to the child, the agency shall document the steps that is being taken to ensure that the child's foster family home or child caring institution is following the reasonable and prudent parent standard, and the child has regular, ongoing opportunities to engage in age or developmentally appropriate activities, including consulting with the child in an age-appropriate manner about the opportunities the child has participated in. While foster parents are going through the licensing process, they will need to be instructed to complete the reasonable and prudent parent caregiver training. Foster parents will print off a note sheet and complete it during the training. The certification worker will use the note sheet as verification to ensure that the foster parents completed the training and will enter it into My SACLIS. The certification worker is to answer any questions the foster parent has regarding the standard. The worker can complete the verification in the 3130 Initial Foster Adoption Home Evaluation. For those foster parents without access to a computer or printer, the certification worker is to assist the family, such as taking a mobile device to the home and allowing them to complete the training. Certification workers are to discuss the reasonable and prudent parent standard with the foster parent at the annual or renewal evaluation. The certification worker is to answer any questions the foster parent may have and provide any helpful resources, such as the DHS 5331. Understanding how to apply the reasonable and prudent parent standard is important to normalcy for our foster youth. Normalcy is an important component of well-being to ensure that foster youth are able to have normal experiences and engage in activities that are age-appropriate and allow them to grow. Throughout this training, several examples have been used to show how the standard should be applied to everyday experiences. Although every potential situation cannot be covered in a training, knowing where to get additional information is critical. Congratulations on completing the reasonable and prudent parent standard. Training for child welfare and residential workers.